Hey everybody, Dan here with Pain for You. Today's topic is going to be uncertainty delays recovery. So I'll tell you what I mean by that in a minute. I'm going to take a couple of nice breaths. It's Friday night here. I figured I'd get this in before I go to sleep. Breathe in the peace. Exhale the stress. Breathe in the smiles. Exhale the frowns and the anger. All right. So, uncertainty delays recovery. And what I'm talking about is clarity on exactly what's causing your pain. So I've talked to a number of people recently, one in particular, who's kind of been on the TMS train for about a year and has read and can kind of quote, the various people out there, myself, Nicole, Ozanich, Schubner, all these different resources. She's on Curable. And as I was talking to her, she kept on saying, arthritis. I've got arthritis. I'm getting older. And she was my age, about 56. And so I pointed out, and I had to keep pointing out, that as long as her brain feels or believes that it's the arthritis and getting older that's causing the pain, it doesn't matter what TMS emotional work you do, it's not going to let go of the pain because the brain is uncertain. It's kind of like half of you saying, well, it's this mind-body stuff. Feel your emotions, it'll go away. But you've got arthritis. So every time she climbs the steps, her knee hurts. And now her feet and her toes are hurting. And her hands are hurting. First it was her right hand. She thought she injured it doing a little bit of work with a drill. But then it became both hands. And the left hand didn't get hurt. So clearly, TMS, she got a 41 out of 50 on the pain test. And if you are listening, the only reason for the pain is TMS. It has nothing to do with your perception that you're getting older and your body's falling apart, right? The belief that you're broken is the problem. The fact that you're 56 is not relevant, right? I don't think the brain knows how old you are until you tell it. There's people in their 80s and 90s with no chronic pain. Now look, some people do have pain in their later years. But what's their mindset? What's their belief system? I'm old, I'm going to hurt. Many of these people have TMS or learned pain that's become chronic through fear, focus, attention. TMS, right? So, if you are still uncertain as to what is causing your pain, please don't be surprised when it doesn't go away, right? Because a confused brain is always going to default to safety, which means if it thinks you got a bad knee, it's going to give you pain every time you try to climb the steps. Why? Because the brain's job, keep you safe and keep you alive. And if it thinks you got a bad knee and you keep climbing those steps, it's going to try to stop you. And the warning signal it has is pain. So, be very clear that your symptoms are from TMS, this mind-body syndrome. As long as you keep convincing yourself that it's physical, your brain's going to keep it persistent. So, lack of clarity, lack of certainty will absolutely delay recovery. So, raise your hand, comment below. Are you still second guessing whether or not TMS is really the case? Do you find yourself saying, wow, but I walked too far and it really hurt, so it must be physical because I overdid it? No. In that example, walking too far is perceived by the brain as dangerous because it thinks you got a bum knee, so it's going to turn on the pain to make sure you stop walking. That's all that's going on. It doesn't mean you're wearing out your physical body, and therefore your physical body is screaming. No, it's the brain screaming, stop it, what are you doing? Why are you walking so much? You've told me 10,000 times you got a bad knee, you're getting old, it's arthritis. You see how this works? So, I thought this was a really good topic, not just because I had this conversation with somebody today, and I hope they're listening, but because I think it's a useful message and a useful lesson for others to learn. And again, it doesn't matter how good you are at feeling your feelings and soothing your body and calming your body down and trying to be indifferent. If you keep on teaching your brain and confirming with your brain that your body is the problem, because you keep on using various physical treatments, ice packs, heat packs, right? The brain is not going to let go of the physical cause of the pain. And as long as it thinks it's physical, every time you do some physical movement, the brain's going to go, stop, stop, stop. Here's some pain. Does this make sense? I hope it does. I'm doing my best here. The need for certainty is really strong, because without that certainty, you're definitely going to delay recovery. So if you don't know if you have TMS, go to yourpaintest.com. That should forward you to danbuglio.com. There's a pain test, 10 questions, take you 5 minutes. And if you have symptoms other than pain, substitute your symptom for the word pain. There's another assessment at the PPD, at ppdassociation.org/symptoms. Answer the 30 questions. The more you say yes to, the more likely it is you've got TMS. You can do this self-assessment yourself. While it might be nice to have a TMS medical doctor give you a diagnosis, I'll tell you what, if you're getting a high score on that pain test, anything over 29, it's conclusive. Your pain is behaving like mind-body neural circuit pain, not structural physical pain. They behave differently. So get that clarity, get that certainty. Eliminate the uncertainty. It's more important than you realize. A confused brain is always going to default to safety because that's its job. So stop using words like arthritis and bumdy and I'm getting too old. And I told this person, I said, look, I'm your age. I don't have any chronic pain anywhere. I guarantee if we were to both get x-rays, we would both have similar arthritic degeneration throughout our bodies. Why? Because everybody does. It's called aging, right? The statistics are really fascinating. As we get older and older and older, the incidence of structural abnormalities climbs higher and higher and higher and higher. And these are within sample groups of people with no pain. But yet, the percentage of people as we age with all of these degenerations, bulging discs, herniated discs, spinal stenosis, spondylolisthesis, all of these scary sounding medical terms, even in the sample groups of people with no pain, the older we get, the more people have them. They're not dangerous. They're not the cause. So please get very clear. Be certain as to what's causing the pain, because when you realize and you believe and you know and you trust that the only reason you're hurting is this mind-body TMS neural circuit pain, it's a lot easier to turn down the fear level because you realize, wow, I'm not broken. I'm okay. So please get that certainty, that clarity. If you're uncertain, do the assessments again. If you need to, go read another Sarno book. Understand the core message that Dr. Sarno published first in the 70s or 80s is you're not broken. Your abnormalities are normal abnormalities and not the cause of the pain. How do we know? because countless people with all sorts of abnormalities, structural abnormalities, are getting better every day. You can too. So please raise your hand, comment below. Are you still uncertain? If so, that may very well be the reason that you are still not able to turn off your pain. Get clear, get certain, and remind yourself often in a nice, calm, reassuring way that my body's fine. So I hope this makes sense. Love you guys and gals, and I will see you tomorrow.